Heart disease kills more American adults than anything else, and early treatment can be a lifesaver. However, a Consumer Reports investigation finds some healthcare providers are cashing in by marketing expensive, unnecessary heart procedures to healthy patients. Joining us now is Dr. John Santa, director of the Consumer Reports Health Rating Center. Doctor, good to see you here this morning.
Thanks
so
for having
basically,
me.
the crux of this is Healing Hearts is a money-making machine that really, from what this study is saying, drives profits over science.
That's right. We're concerned that some people are having too many tests and too many treatments as a result, and some of that's driven by profits, not good science.
Most would say my heart is very, very important, and that there's no amount of money that would preclude me from getting some type of test to make sure that my heart is healthy. Can you see where people's attitudes would be that?
Absolutely. And there are some very good, very effective, and very inexpensive tests, and actually many of those aren't being used as often. And it's frustrating to us because many tests that are expensive, potentially dangerous, and aren't effective are being used.
Yeah. What are some of the tests that people are maybe overdoing it?
Well, we did a survey of almost 1,200 healthy 40 to 60-year-olds, no disease, no symptoms, no risk factors, and found that 44% were getting ineffective tests like EKGs, stress tests, or ultrasound of the carotid arteries.
Is there any negative, any downside to getting these tests, aside from the fact that it's costing you money if you don't need them?
There is. These tests aren't very precise when it comes to detecting early disease, so they can be falsely positive, meaning that you'll get a cascade of additional tests and sometimes treatment, including angioplasty. You could end up with a metal stent in your coronary artery for the rest of your life and maybe not need it.
Doctors tell you that maybe you should get this test or maybe you should get that test. Most people would probably listen to the advice of their doctors. Are doctors giving some bad advice to patients?
In some cases, unfortunately, they are. Most doctors are emphasizing the big five tests: blood pressure, cholesterol, diabetes, taking small doses of aspirin, and stopping smoking. Those are the big five. But obviously, doctors are, in some cases, recommending tests that aren't very effective, and in some cases, treatment that isn't.
So what do you tell patients that are given advice from doctors who they, I would think for the most part, trust?
Well, they need to do their research. They need to use tools like we're offering that actually offer ratings of these tests. We're also offering ratings of heart surgery groups so that they can more easily sort out who are the best heart surgeons to have their surgery.
Exactly. What goes into this whole rating system that you're talking about here?
It's a three-star system. 323 heart surgery groups across the country have released this data. 81 of the groups are three-star, very good performance information. 238 are average and 5 are below average. And the important thing, though, for patients to know is that almost all heart surgeons have this information. Ask them for it. And if they aren't willing to give it to you, maybe you should look for another surgeon.
Yeah. So basically what it just goes to, do your research.
Do your research.
Don't just take the advice of your doctors, do your research as well.
That's right.
All right. Dr. John Santa, thank you. Good to see you this morning.